Afternoon. It is 1 p.m. Pacific, 4 p.m. Eastern on November the 18th. This is THCB Gang. I am your host, Matthew Holt. We're going to have a conversation. We didn't get one in last week because I was in Italy. I tried to round up an impromptu European THCB Gang, but it all fell apart late in the evening due to too much pasta and red wine. But today we're back. I'm back in the US, and I have an all US-based crew here. Ian Morrison, health futurist from Menlo California. Jeff Goldsmith from Virginia at Health Futures Inc. Vince Kuraitis from the wilds of Idaho, consultant and policy analyst, and Lygeia Ricciardi, now CEO of AdaRose from Washington, D.C. So how is everybody? Are you all feeling good? All right, fantastic. Yeah. And Lygeia, thanks for breaking up the excessive, aged X chromosome fest going on. It was very good for having a much more even balance, but the X chromosome, sorry, the X chromosome, you're breaking up the Y chromosome thing. Let me get my chromosomes right. I've been talking too much genealogy. All right, fantastic. Well, let's kick it off. Quite a couple of weeks, we finally got one part of the infrastructure bill passed, which has got some healthcare related stuff in it. And there's been a lot of other wild stuff going on in the world. So why don't we start with you, Lygeia? Tell me what you've been up to and what you've been looking at the last couple of weeks.
Yeah, so I want to actually look at an issue that I've been thinking about, and I know a lot of you have too, but particularly I spent a number of years really worrying about the issue of patient access to data. And so in the last few days, I've been looking at some research from several different places, including the AHIMA Foundation and Pew and ONC, and asking the question, what's going on with patient access to medical records and what's the impact? So that's something that's on my mind, although it's not necessarily like an of the moment current news thing. It's something I want to follow back up on and be like, how are we doing?
Well, there was a little bit of controversy recently about whether some of the APIs that were available on the Firebases were actually were secure or not secure. That's just one little wrinkle in that whole thing. But yeah, we should deal with that. I know Vince spent a lot of time thinking about that as well. Ian, what have you been up to other than wandering around hanging out with your grandkids?
Yeah, well, hanging out with the grandkids. But I actually was on the road in the last couple of weeks for the first time in a long time. Actually, not just visiting grandkids, but actually visiting with hospital folk in a board retreat for a system in Iowa and then in New Jersey. So I sort of got insights from the road, I guess, for the first time in a while. And I would just say, again, something we should talk about is the whole, provider workforce burnout, the great resignation. I mean, I was in a room with 200 docs on Friday in New Jersey, and while they're feeling better, that system took care of 35,000 COVID patients, and they've been through the ringer. So my sense is a lot of people are spent. I don't know if you all saw Ed Young's piece in The Atlantic, which I think captured maybe a little more extreme the workforce challenges, but I think we should talk a bit about that and what that means longer term.
Absolutely. So there were 200 people at the room at the start of your speech, and by the end, 15.
I was down to about 12. Yeah. I want to talk about Lygeia's issue too, because I had my own patient experience at Stanford, and actually had a fairly positive interaction with the patient data. So we could talk about that.
Yeah, there's a lot of people working on some interesting stuff there, and we'll see how much it matters. Vince, what have you been up to? What have you been looking at?
Yeah, likewise. I'd love to talk about Lygeia's issue. I'll share a couple of items. One is a story that I read this week, and it's a line I wish I'd come up with myself, but it was in Home Healthcare News, and the headline was written by Joyce Fama Kinwa, and she phrased a provocative question. The question was, are healthcare providers having a blockbuster Netflix moment? And the reference being that Blockbuster never got the fact that distribution channels were moving from DVDs to streaming, and in turn, our health systems missing the notion that the locus of delivery is really moving away from being centralized in doctors' offices and hospitals, and moving to the home and the community. And I suspect that will be a provocative but friendly jab to Ian and to Jeff. But I'd like to put that out for further discussion. I at least hope you find the phrasing interesting. The second item, and it may seem contradictory to what I just told you, I spent a couple hours this morning listening and reading the slides from the Teladoc investor presentation. They had 5 speakers, and frankly, it was a disaster. Their stock price is now 9% lower than it was before the presentation. I thought the presentation was really pretty well done. There's a lot of interesting details that come out of it, but obviously the investors didn't like what they were hearing. So with that, thanks, and great to join you all.
Oh, thanks, Vince. And speaking of somebody who owns a bit of Teladoc stock, because I thought it was down at its lows around the 150s. Wasn't anticipating that their investor day would
I think it's at 120 something right now.
But it's interesting because they've got so much stuff on board within Teladoc. You'd think that they'd be starting to figure it out. Maybe they are not. But anyway,
and worth noting that what at the peak it was about 250 last year.
Well, at the start of the year it was kind of crazy. Then the rest of the world was kind of crazy. Even so, it came down. We'll see how it goes. It's still by far, even today, it's still by far the biggest market cap of digital health stock. Most it's still hovering around 20 billion, and most of them are hovering around 3 to 5. And while that's been going on, this is my take of the week, the health plans who are now public, including Clove, especially Bright and Oscar, had a really bad stock the last couple of weeks. They're way off, and they're not looking.
Yeah, they're
really
Oscar
hurt.
Has a new way of burning money.
They certainly have figured it out, as has Talkspace and some of the others. It's not a pretty picture on the public markets. The private markets are still awash in money. Jeff.
I'm still stuck on COVID, guys. 114,000 new cases yesterday. 114,000 new cases yesterday, and 1,600 deaths. COVID census dipped below 50,000. It's 50,000. I mean, we're really. I have trouble figuring out how we avoid a 5th wave of this. And I mean, apropos of the comments I heard earlier, I mean, our physicians and nurses, I mean, they're beyond sick of this. It's, the heroism, the sort of 9/11 moment thing maybe applied to last April or May. Now it's a flood of people that did it to themselves, largely self-inflicted. I mean, I realize that caregivers render a lot of care to people for conditions that they had a major role in, whether they were smokers or, obese or whatever, but we don't have a vaccine for smoking. Smoking is only mildly contagious. Now it's really discouraging to me. And I kind of, I've been listening to all of this testosterone-driven BS from Xi Jinping about the superiority of their totalitarian dictatorship and how, they've taken care of their people. I'd really like to be able to make a stronger case for democracy.
Well, I mean, I think, you're right. You're going from how do we get this done? But if you look at what's happened, right, across vaccination rates, I mean, we were first for a long time because we did Biden got in and said, we're going to get this done. And then we had the vaccines. And we basically stopped around 60%. And that Eric Table pointed out on Twitter today, that encounters people who have the first just one J&J, which is better than nothing, but not as good as it should be. I've spent this morning trying to get a appointment for a booster shot in California. Now it's everyone. That process is still a mess, essentially a year later.
Why? I just walked into Walmart and got mine.
Yeah, I was told I could walk in. Last time I went to see this, I was told I could walk in and find, but only at certain times and what have you. And it's a lower. If you do the Moderna one, I think Moderna is a lower dose. But nonetheless, if you look at Europe, right, they're all ticking up a lot. Austria's just gone on lockdown for some parts of Austria. Germany is in in trouble. I was just in Italy last week, and they were doing a good job asking you for your vaccine pass everywhere you went and all the rest of it. And it seems to be that even those countries which in general have now caught up or gone ahead of us on the vaccine front, who are taking it more seriously than many parts of the US are taking it, are still in trouble. I'm with you. I don't see how we get away from a fifth wave, whatever it is now, and that's a big problem. The other thing I actually, before we get on, I'd love to get Lygeia's bigger question about data. But I'd love to think that there's, I don't know if this is one of those wacky things, but if you're looking at the opinion polls about how poorly Biden's doing, how poorly the vote for the generic Democrat versus the generic Republican is, it's now a massive gap for the congressional elections next year, right, which is a year away. Now, okay, we're a year away, and who knows what, and then we have this crazy stuff with the school boards and what have you, and the Virginia election. But I'm wondering how much, the combination of gas prices going up and COVID still being around is just getting blamed on the current administration versus, whether it's actually they didn't get the policy done for Build Back Better or whatever else. I'm wondering whether the politics have just bored them with those things. We need to have another change, because I can't believe that anybody rational thinks if we go back to Republican administration, Republican Congress, or the Trump administration, we're going to have a better management of the COVID situation. But
well, speaking, you mentioned the Virginia election. I live in Virginia. I voted on November 3rd or whatever it was. It was a Terry McAuliffe ran a Hillary Clinton style campaign. It was like, it's so blatantly obvious that I'm superior to this fellow. Oh, by the way, was a McKinsey person. This was a smart young man that beat him, and he just ran a complacent, I'm really not sure why we're even doing this. Why don't you just make me governor type of campaign? And he deserved to be beaten. So if the Democrats need to wake the fuck up, and you'll pardon my language, they need to wake up. They are hanging on by their fingernails, and I don't think Americans feel better that there's this regime in Washington or whatever. I think they're waiting for the society to get moving, and it isn't. We're going sideways, and whoever is the incumbent, whoever's in power, is going to end up getting blamed for that.
Anyone else got a thought on the politics of this?
Yeah, well, I just weigh in that I do think if the election were held today, it would be a real problem, because I keep coming back to what I thought was the pivotal question in the exit polls when Biden was elected was basically, putting COVID over the economy, right? It was, if you ask the question, which is more important, and they were making progress. I was with Andy Slavitt last week and had him come down to MLK to visit, because he lives in LA now. And when Andy left the White House, we were second only to Israel in terms of vaccination rate. We're now like 158th or whatever it is. And I got to say, I was in Hawaii with my Canadian brother-in-law and sister-in-law, and they were mortified. And Hawaii is one of the most heavily vaccinated states, but they were mortified at people in restaurants who were not doubly vaccinated, and no proof of vaccination had to be shown. You had to get into the state. But and I don't know, Matthew, you're reading from being in Europe a couple of times in the last few months, but some places are taking it more seriously than others.
Yeah, I'll tell you, I'll give you my 4-city tour. I went to Vegas, which bizarrely was quite serious. This is August for him. A lot of masking in the casinos, double masked at the conference, all good. I went to the UK, where no one seemed to care about it at all. I was asked once in the lineup for the Chelsea match I went to for my vaccine certificate, but you could go to any restaurant, any pub, no one cared, and no masking on the underground, no masking in public transport at all, even though it said you should be wearing one, maybe 10% of the population doing it. Went to Boston, where I think people took it very, very seriously, and masking on the underground, and and I just went to Milan, which was the most serious of the lot, and obviously was of all the cities I mentioned, was the one which had it the worst. Italy, it was now a year and change ago, but I think there are strong memories in Italy about what happened. But I'm with you, but we really are. I mean, I know it's pretty incredible that it's the Fifth Circuit based in Louisiana, which is incredibly right wing, is the one that's knocked down the mandate, Biden's OSHA mandate to get for companies to have all the employees get vaccinated, which is supposed to go into next year. I don't know what happened when that goes to the Supreme Court, because it's a pretty good precedent for vaccination mandates. But we have the multiple problems, right? Which is the vaccine clearly is wearing off, although the booster shot is going to help. Although, as I found out this morning, figuring out when the booster shot is and where and how to get it is trickier than you might think. But we've also got the other problem, which is that there are just places in this country where people just don't believe it anymore. They're just,
right.
People are just done, and large communities are just done. It doesn't matter.
I've got a guy that works on my property who is not vaccinated. He's a smart guy, and I had a long talk with him today. I gave him some articles about the vaccine and the fact that it works and it's safe and it dramatically lowers your risk of all the rest of it. He's unvaccinated, and he said, when you asked him why, he said, I just flat out don't trust our government. I just don't believe that what they're doing is valid. I mean, and it's really hard to argue with someone that feels that way. And there's, I don't know, 40 or 50 million people that feel that way.
Yeah. And some of those people, by the way, have really surprised me in that they are people they're highly educated who live in very maybe democratic areas. I have been surprised by some of the folks that have kind of come to that position for one reason or another. And it's a variety of reasons. Sometimes it's fear about distrust of healthcare generally and putting anything in my body that may have an impact similar to the whole vaccine autism thing. Like, I'm afraid of more chemicals, that kind of thing. And on a certain level, I can see it's not that we should always all trust that the healthcare system will do what is in our best interest. There's an argument there. I get that. Yep. But on the other hand, it's like, where are you getting? I think one of the biggest problems is, where are you getting your information? Right. Probably most of us on this conversation get them from, similar sources. We trust the CDC, we trust the WHO, whatever. But like, that's very different from what you hear on conservative talk shows. And if you start from those facts, you've just got a whole different analysis of the situation.
Well, and Lygeia, 30% of healthcare workers have not been vaccinated.
Yeah, see that.
30% of healthcare workers who have bachelor's degrees and,
well, and who chose to work in health.
Yeah, exactly. Who are, I don't know. We've got a problem.
Right.
No problem. We have no obvious solution, right? All right, let's
really
go on, Vince, and then we'll move on to the data topic. But Vince, jump in.
Well, so this influenced my point of view about mandates. There was an interesting article in the Washington Post about the psychology of mandates. And the gist of it was that if you have a choice, there is a lot of angst because you have to decide, and there's a risk whether you take it or not. And so the default is, I don't take it. But you externalize that with a mandate because it's somebody forcing you to do it, and you have less internal angst, was the gist of the article. I found that to be really interesting and persuasive. And we had mandates for polio. We haven't had people riding in the streets about flu shots. I just don't understand the politicization of this issue, and it really is sad.
And in general, where we have had mandates, they've been enforced, like in the military and hospitals and elsewhere. You've seen those numbers really come down. It's only a really small minority. So I don't know. It's
or school even. You have to have certain shots to send, for your kids to send them to school. Measles, mumps, rubella, whatever they are.
Well, I guess
Trump came up with the vaccine too. I mean, he was touting I can't remember the name of the initiative, but
Warp Speed, Operation Warp Speed.
Yeah, Warp Speed. That was it.
You should have called it the Trump vaccine. It would have helped a lot. But,
right. Well,
by Jeff, and then we'll go to.
I just, to me, maybe the fact that people thought about this like it was the flu is part of what got us into trouble. And if it was smallpox, with a 30% lethality rate, then maybe it would be different. But I guess, 760,000 dead. We sent hundreds of thousands of troops and spent trillions of dollars to respond to 3,000 people being killed in the Twin Towers in the Pentagon. That's 2 days worth of COVID fatalities, 2 days worth of COVID fatalities.
It's amazing.
So I'm just, not a lot baffles me, but this baffles me. I don't understand what's going on in our country.
All right, well, let's go to something easier to solve, which is healthcare data interoperability. Lygeia, you wanted to bring that up when you started. We've
Yeah,
obviously
and you know
talked about
what?
this over the years.
I actually want to connect. I think obviously the topics are connected because a part of this is about what is the public understanding and what is their trust.
Mhm.
So I've been, obviously we've had a number of programs over the years, government programs, whether Meaningful Use, the Cures Act, et cetera, to push this, not only interoperability on a grand scale, but I'm particularly interested in the patient access to data piece. So I was looking at recent reports, as I mentioned, by ONC and by the AHIMA Foundation, some data that's about a year old from Pew. On the whole, it looks like 59% of Americans have been offered access to their records online. That sounds pretty good, actually. I feel good about that. Roughly 24% have actually accessed those records. I don't think that's necessarily a bad thing. In other words, I don't think success is everyone who's offered uses it, although that's debatable. It may be like only when you have need, because a lot of people felt they didn't have need for whatever reason. Interestingly, still 24% of the population says, I have no idea where to go to get my health information. I didn't even know that was a thing.
Wow.
But I guess one of the things that I find, there are a couple things that I find troubling. One is that underserved populations generally, if you look at education and income levels, and particularly people in more elderly groups, tend to have a harder time getting their information, and they're confused by the process, don't know how to get it, where to get it, et cetera. But this was what really kind of floored me. So in the AHIMA Foundation's research, 75% of people leave their doctor's office unhappy and confused. And a lot of that is about information and or communications. So sort of begs the question, like, even if you do have access to your data, and it's harder for these underserved groups to get it, what's the value? What are they getting out of it? We're managing slowly to push data out and to make it available to people. And it's kind of helping some people, but unfortunately the people who need the most help are not totally benefiting from it. And I think the way in which maybe the information is presented is not optimized, certainly, to meet people's needs.
If I can comment, Lygeia, I think one of the weak links is that health information really is not being pushed from the health system and your doctor. I mean, it is available to you, but and I think I see a potential solution on the horizon. It's really interesting. Graphite Health, which is a consortium being formed by 3 delivery systems, one of which is Intermountain Healthcare, and I can't remember the other 2 off the top of my head. But they're what we've got in the world of healthcare apps right now is the Wild West. There's 350,000 potential apps out there, and very few of them connect up with the local health system. And if you're a doctor, you got 10 diabetic patients and they're each bringing in their own app. You throw up your hands and you don't use any of them. So the process that Graphite is going through, I think what they will do is they will designate and build a platform that allows health systems really to be in the driver's seat and effectively authorizing or mandating or pointing to not 10 different diabetes apps, but these are the 2 that your doctor and your health system want you to use. I think that's really worth watching, what this Graphite Health Group is coming up with.
Yeah, and they're not the only ones, right? There's Commure, which is very well backed and it's now connected with a bunch of other health systems, which is doing the same kind of thing. But I mean, as you say, we're going to build out a platform and plug more and more health systems into it.
Yeah.
And you've got a lot of people who are not traditional health systems doing the same thing, right? Obviously, the bigger health plans that the Uniteds and Humanas are going on this path as well, as are a ton of startup and now publicly traded medical groups. You still got, to me, the same issue, right? Which is that this is a problem primarily for people who have either complex chronic illness or complex acute illness. It's basically diabetes, heart disease, or cancer. Some variant. There are obviously others as well, autoimmune disease and others, who are doing a lot of what we still see going on, which is going around doctor after doctor, trying to find the right diagnosis, the right treatment, and looking, and it's where you see things like the practice variation and the treatment variation that is still prevalent across the healthcare system. And if you talk to the really smart patients, I know Lygeia knows this crowd very well, but the really, smart, switched on patients, they still have a lot of trouble getting access to their data. In fact, Devon's not on today, but that's the problem Citizen was set up to fix, which is a lot of this data is not just in the portal of just the results or the orders that's in the portal of the EMR, which is better than nothing. Ian will have to weigh in on his Stanford experience. But the other thing which strikes me is that you've got these different types of data, and then the interpretation of the data, the normalization interpretation, is still tricky, even if we now have better access to it than we had before. My solution is that I don't think this gets solved by consumers. This gets solved by consumer agents. It's just like most people in the end don't do their own stock trading and crypto trading or whatever. Most of them use a financial fidelity or some kind of recognized financial advisor who manages the process for them. And I think that, you're seeing this grow. You're seeing this well-funded. Grand Rounds now included health. Accolade is publicly traded. Transparent, Glenn Tillman's new thing, and a bunch of others I'm starting to see you pop up in the cancer space. In fact, Adam Pellegrini, who's been around all the digital health areas, has now got a new startup called Jasper Health, and I ran into one called Outcomes for Me yesterday, which are trying to figure out, can we do this? Can we manage the process for cancer patients? And more of that, to my sense, is going to be, there's going to be a consumer intermediary layer, which is going to take, essentially be an advocate to take care of people. The question I don't know the answer to is, do patients trust either their primary care doctor or groups of primary care doctors or new types of primary care doctors to do that? Do they trust health plans to do that? Probably not, but the health plans are in a good position because they see all the data, with others don't, or do these new kind of third-party independent groups show up and somebody figure out how to pay for them? Because right now they have to pay for themselves by reducing usually back surgery or what have you. But I don't know. I the more you look at this, your point, Lygeia, that not that many people take it up, even when they're offered it. It seems to me that most people don't need it. If I look at myself, I go to the doctor occasionally. It would be nice to have it, but I don't really need it. Whereas somebody who has intensive problems and wants to move between different doctors and find out different solutions, they're the ones who need that data.
Well, yeah, my other point is, if you go and download your data from a portal, even those of us who are fairly well versed in this can sometimes be a bit confused. Like, what is going on? What does it mean that number is out of range? What's important here? It doesn't make sense. And I actually agree with you. I think that we're probably moving toward a model in which there is sort of an intermediary who I would term as like a coach generally, or a guide who can help people kind of manage day-to-day health in a way and serve as that link between specialists or doctors and sort of daily life. A thing that I've found really interesting over the years, maybe not surprising, is in some ways I feel like it's less important what's in your medical records, although that's super important for people with rare diseases, complex diseases, et cetera. But for most people, less important is what's that medical record on file with my doctor or insurance company. More important is what's happening in my body right now. And how is it being, things that you can get from devices and other sources that may or may not be connected to your healthcare provider, probably should be through this kind of coaching arrangement. But ultimately, it's not like I thought years ago. It was like, oh, if we could all get access to our data from our doctors, we'd be so much smarter and whatever. And given the choice, I'd probably rather just pull down a lot of live data about what's happening to me now.
Actually, and just I'll go to Ian in a second, but it's worth mentioning last week, had a very interesting, not last week, 2 weeks ago, had Anish Kokra on here, who's the cardiologist from Philadelphia who likes being contrary. He actually has already set up remote patient monitoring for a bunch of his patients. Yeah. Some of them he has that and doesn't talk, and then some of them he says they just have to come in. That has to be an in-person thing. So it's definitely horses for courses. But I think that there is some interesting data being developed between the doctor's office or the health system and the patient. And you're seeing a lot of interest, a lot of activity on the venture front. I mean, Current Health just got bought by Best Buy, and there's a whole bunch of other activity in these kind of health remote monitoring solutions, which Medicare is now paying for. So there's a lot of activity going on there, which is generating some of that data. Who controls that data, and where does it end up, and how does it get used, and how does it get interpreted for the patient? And that I think is very much TBD. But that sort of patient-generated data is starting to become more important. Ian, sorry, you.
Yeah, well, just a couple of points. I mean, just to tie it to, and I think you kind of answered your own question, Matthew, because I think it depends on those different use cases, right, of patients that you're pointing to. I mean, I'm on the Founders Council of United States of Care. We had our board retreat earlier this week virtually. And one of the tenets that they're trying to solve for from a policy perspective is this issue of, we have a health system that's very confusing to navigate. So there's the navigation piece, but you answered or you made the point, Matthew, about when you have either a chronic condition you're trying to manage on an ongoing basis or an acute condition. I can tell you that when I had my adventure at Stanford, having a 4 foot of bloated colon removed through a small incision in my belly, I actually had a
wonderful... We don't have video of this.
I didn't have. I actually have pictures, which is the other downside of patient access. I was in a duel with Bob Wachter about who, I was volvulus of the year. But anyway, but the point is that even though, I was a Palo Alto Medical Foundation patient being referred over to Stanford, in both institutions, I was, my charting with my docs, and they were being incredibly responsive. And that's the other point I wanted to raise here. The other side of this trade, I just got off of listening to Grand Rounds with Mark Larrett, UCSF, who's retiring. And I don't know if you follow Wachter on Twitter, he's been pointing to this 5-fold increase at UCSF alone in electronic messaging on Epic. I mean, I remember having an exchange. I had some mundane, post-surgical, question. And my brilliant, gifted surgeon at Stanford, she got back to me at 10:26 on a Saturday night. I'm going like, girl, get a life, It was remarkable to me. So I actually, on the other side of this, is one of the reasons, and Wachter made this point at Grand Rounds 25 minutes ago, one of the reasons docs are overwhelmed is not just COVID, but we've turned on 24/7 communication with this messaging, and they're just been inundated with it.
But that's a super important point you just made, Ian. And I mean, I remember this when the electronic health record was introduced. People were talking about it as if it was a data management tool. It's a communications tool, and a terrible communications tool. It doesn't really work as a communications tool. But people were, the crucial part of the data is, what does it mean? And that is something that you can't, the data doesn't tell you what it means. Someone needs to tell you what it means. You need to be able to ask questions and get answers and be educated. And
so,
that's
but
the
a
part
really key part is,
broken.
it doesn't have to be the brilliant surgeon necessarily. It
Right.
may in some cases, but let's offload some of that into somebody who can basically explain, the key metric. There are times when you have to talk to the surgeon directly, I'm sure, but like in general, the basics, you need sort of more of a team-based approach and not laying everything on the one specialist.
But it's interesting that there's a change, right? Because Bob has been showing this, the 5-fold increase. I think a lot of it's to do with the fact that it's telehealth and new people using that channel, and then asynchronous messaging becomes part of that compared to what it was. But when he looked at the original studies around open notes and the original studies around Kaiser first rolling out messaging backwards and forwards, people were incredibly respectful of the messages they were sending their doctors. They weren't inundating them with stupid questions, and it wasn't that bad. It's something seems to have changed there. And then we have two things we haven't fixed, right? One is we haven't yet got the team, the air traffic control, the care, what John Lamb called the care traffic control coordinator. So, it shouldn't be your surgeon responding to you, and she's too important for you. But nonetheless, it should be somebody, it should be like the nurse in the Philippines who was overseeing my COVID test. Have you done one of those live COVID tests? Yes, I've done it have to do it for travel, where you have to show you have to get a certification you actually were negative. Somebody's watching you while you do it, and it's the nurse in South Africa or the Philippines or wherever. So someone like that should be, managing most of your questions, and the rest of it should be managed, or some kind of team managing the whole process, and only getting to the surgeon when it really needs to. And then the other, which I think most American healthcare hasn't got to yet, and the other thing, which we are promised, and it's going to get there, I'm seeing it in flavors of some of the stuff I get demoed, but I don't think it's out there in the wild yet, is AI-based chatbots which actually can answer 90% of your questions. I see Jeff grimacing at me. Reminds me of an article you wrote in Health Affairs 20 years ago, Jeff.
This is, I mean, Lygeia used the key word about 20 minutes ago, and that word is trust. And, to get from a situation where I have 5 MyChart accounts, 5, okay, that the people involved don't talk to one another because they're in different institutions. The communications part of this is absolutely dependent on trust. And, the trusted relationships, I mean, what we're going to see now, and you said it, Matthew, there's a whole bunch of people that want to be the platform that is the connection between this data, all these apps, and the patient, because they all sense the same thing. And, what Vince said earlier, 350,000 apps, it's like a swarm of sandflies. You breathe in and there's sandflies in your lungs. This is not working. So somebody is going to be the trusted integrator of all this crap. And I'm not sure. I mean, that to me is the $64 million question. Everybody that Jess DeMassa interviews want to be the platform. They want to be the integrator. They want to be the trusted source, whatever. I think this is really going to be a circus.
And it's taken a while, right? Because you've got
so,
which actually gets us to the impoverishing session that Vince saw this morning on the Teledoc. Is it possible that this is going to be an independent tech company, whether it's one dedicated to healthcare like a Teledoc, which is the one that's, if you like, showing the best at the moment, that's got enough pieces that it can actually do that? Does anybody trust, a Medicare Advantage or a big health plan enough to do that? Does anyone trust our local provider system to actually competently get it right? Looks to me like UCSF, hasn't, at least, or Stanford hasn't yet figured out how to resolve this for their doctors compared to dealing with Ian, late night on a Saturday. Did you write to her at 10:58 p.m. on Saturday?
No. She was getting back.
You wrote on Monday and she replied on Saturday.
Yeah. No, I mean, it was like, but I mean, and look, it also ties back to the important question Vince raised at the beginning about this sort of Netflix blockbuster moment, because one of the things I would say with regard to that point, and tie it back to the patient overload question, is everybody I've talked to in the last 30 days of health systems has going through exactly the same thing. ER volumes are now back up to pre-COVID levels, which was not true 6 months ago. Right. Everywhere I'm talking, they are full and jammed with sicker patients who have had postponed care through COVID. And this is not in markets where the COVID admissions are up. It's just generally the case complexity and so forth is up significantly. Plus, you've got this 24/7 faucet being turned on of digital communication for those health systems. But I think you got it right, Matthew. I mean, there's a lot of different ways this could play, all the way from the chatbot enabled synthesizers to Glenn Tallman wins. And then you've got to put the employers in the middle of this. I've been talking with PPGH the last couple of weeks, and they're very concerned, and their members are very concerned with this absolute tsunami of what Jeff was talking about, of these point solutions where there's no referee, and who's going to referee what actually works? Because there's so much, smoke and mirrors out there right now, and they're a target for it. So there's a big sorting out, I think, we're going to see. And it's not clear who wins. I think some health systems will win. I think there might be new platform folk that Vince have written about emerge, but it's going to be very intense over the next 24 months.
Well, I would say one minor data point, I've got a few, Vince, is that Amazon just signed its first, what I would call sizable client, right? So it has Amazon Cares and it's sort of thinking about it. It's got, it's essentially a Teladoc-like type of system with a bunch of different pieces. And it just signed Hilton Hotels as its first decent sized client. So maybe there's an entrant there, which is going to be more serious, because otherwise, there's no reason why any of these people, the ones with loads of venture capital, the systems who've got a lot of money and obviously got market presence, the health plans who are growing, fantastically profitable off medical advantage, no reason why any of them would give up and cede that role to somebody else if we're going to have a third party plan. Anyway, Vince, sorry.
So I'll offer, maybe look at this in a 20, 30-year time horizon. Healthcare has been very fragmented. And, with 350,000 apps and multi-gazillion dollars being thrown at health startups, in the immediate term, that's simply adding to the fragmentation of healthcare. But compared to other industries, what healthcare doesn't have, if you look at social media, you look at what happened with Uber and Airbnb, there are mega platforms in many other industries. And I'm going to raise the contention that, over the next decade, healthcare will develop mega platforms. And I see a number of potential candidates. It's not at all clear who's going to win. It could be electronic health records, although I think, they've muffed it. They've never really thought of themselves as a platform. It could be these virtual care platform companies like Teladoc or Amwell. It could be an Amazon, an outsider, or it could be some sort of a coalition like a Graphite Health that I mentioned earlier. But if you look at the consolidation that's going on in the industry right now, the optimistic take is some of this fragmentation over time will begin to go away as the industry gets more and more platformed.
But I don't think, but I'm with you, Vince. I don't think it is analogous to all social media flows down to Facebook and they buy anything that's not it, or they buy most of it, or the same thing on commerce with Amazon or search at Google. It's more like banks, right? There are more.
I would phrase it like, it's if you look at and I did write about this on the healthcare blog, there's a tendency in healthcare. It's not going to be a winner take all one, but there are tendencies of winners take all, where it becomes more of a oligopoly type of a marketplace, not a monopoly type of marketplace like we got with Facebook. And that may even wind up being regional. But the economic force is that this fragmentation is very, very costly. It's very inefficient. And that's part of what's driving the consolidation. Jeff mentioned point solutions. So, there's lots and lots of specialized companies. And my prediction is they're going to get absorbed into some of these larger virtual care platforms. We don't need 20 platforms that are or 20 different startups that are specializing in LGBTQ care or women's care or men's care. I think they're going to get bought up by the Amwells and the Teladocs over time, and many of them will just go away.
Likely. Lygeia, do you think, going back to the point you raised originally, right, which was about consumers' access to this? I was interviewed about not the next 5 years or 10 years. I was interviewed by a Japanese drug company the other day about the next 100 years. Where I was supposed to pontificate. I felt like Ian, but like Jeff, because if they were 100 years old, they're asking about the next 50, 100 years. And I said, eventually we're going to figure out, going to this continual, always-on monitoring system, people with chronic illness and acute illness and blah blah blah. But how much of this is in the end? If you look at the consumers, the patient activists, right, the most active patients that we know, you look at them. They have basically taken this upon themselves. I go back to the e-patient Dave brothers. Yeah, they work with the health systems and their doctors, but they are the center of their own universe, and they're managing it. That because they haven't had an adequate sort of cross-system experience that they might have got potentially at Kaiser if Kaiser have got it right. But do you think we're going to have people kind of more accepting that there'll be one organization which will manage their care overall, or do you think it's going to be much more we'll figure out how to become an activist consumer, or somebody will be the agent of the activist consumer, or the activist agent?
I think there's probably many different, as with everything, there's probably a lot of fragmentation. For one thing, I think the consumers that we know, the activists, have completely bought into the idea of like essentially owning their health and taking responsibility for it. And I think that there's a proportion of the population that sees it that way. And I actually believe that proportion is growing, but it's still not everyone. And maybe I wouldn't call them outliers. There are big parts of the population who don't, who have a different experience. And some of that is rooted around, I guess even people who are very active and are engaged in their health may have trust issues too. But people just kind of view their role very differently. I hope that there's a future in which, I would love to see a future in which that consumer and patient kind of steps into a role of responsibility, or at least agency, greater agency in their own health, with the ability to sort of appoint someone else to be more in charge if they'd like to be, as opposed to just kind of feeling helplessly like you're sort of warding off something, which is kind of the way I feel with regard to certain social media platforms, right? I feel like you have algorithms that are trying to drag me in certain ways, and I'm going to decide not to do that, as opposed to like, I'm choosing exactly how I want to use this thing. So I don't think there's going to be like a one size fits all solution. I hope that there is greater appreciation that it makes sense for consumers to be engaged in their care more, not just because it sounds nice and people call for it, but because literally, if we are more engaged in healthier behaviors, that saves on the bottom line in terms of like cost.
But Lygeia, to arc back to where we started,
yeah,
the 60 million people or whatever that haven't been vaccinated believe they have taken charge of their health.
Yes.
Okay, so what are we talking about here exactly? A bunch of people exactly like us?
That's part of the problem. No, I agree. That's one of the many reasons that I have found the COVID pandemic depressing. Obviously, there are so many, but one is like, for some people, taking health into your hands means not getting vaccinated.
Correct.
And how do you deal with that?
Or using ivermectin,
exactly.
or shining a light inside your esophagus or something.
I've been drinking bleach for months. So I don't know what you guys are.
Yeah, well, Matthew, you look none the worse for wear.
I guess I believe that if you give people, if we start from, it again, sort of starts with like, what facts are you working from? And I would like to, if there were decent levels of trust of the healthcare system generally, and the research system that sort of undergirds it or is around it. And if people were starting from the same basic facts, I'd like to think that most people in taking control of their health would do things that are in fact somewhat evidence-based and make sense. But there are many problems. We've got breakdowns in trust, and the information that people are getting is all over the map. Some of it's just flat out wrong.
I think the reason for the fragmentation is that most healthcare remains local. We have a fiction that there's going to be this national AI chatbot that talks to us and that, maybe is Optum or Teladoc, but the reality is most healthcare is local. And even the hospital industry, for all the, stuff about consolidation, the largest provider of hospital services owns like 200 hospitals. There's 5,000 of them. So, the doctors, physician care used to be just 500,000 or 600,000 ones and twos. Now it's 1 million people that are, in all different stages of agglomeration. I don't see logic here. I don't see some kind of order being imposed. I see a giant, multifaceted power grab for $4 trillion.
Let me try to link this to one of the things we haven't talked about yet, which is, since I think all of you have been on, Don Berwick and Rick Gilfelling came out with a whole series of articles in Health Affairs about Medicare Advantage and the Medicare money machines, they call it. So if you came down from outer space, you landed on the US healthcare system after you got over how insane it was, and you went back to, didn't just turn around and go back to Mars or whatever, you'd look and say, well, we're doing all this stuff with employers, but in the end, and we're doing Glenn Tillman and Transparent and actually heading off after employers. But in the end, people who work for big employers aren't that sick, right? Most people who are sick, who are costly, are in the Medicare program. And the fastest part is, and Medicaid, right? And the fastest part of that's growing of that is the private health plan covering the duals and the Medicare Advantage part and the dual eligibles. And you'd assume that if somebody was going to be managing the care and really helping those folks out and helping them interpret what's going on and helping them make judicious buyers of care, it would be, it could be those players. I'm seeing the horrified look on Jeff's face because I know he's a member of one of those
Who's
players.
actually doing it, Matthew? Kaiser, my parents were Kaiser subscribers. We've had this idea for the better part of 50 years that we want the entire health system to work like Kaiser. Kaiser's up to a grand total of what, 13 million subscribers. Yep. Okay, 13 million after 50 years of trying to encourage people to select a health system. Teladoc, 13 million virtual visits, 13 million, compared to 1 billion physician visits. I mean, we're nowhere close to order here.
Right.
Nowhere close.
Do you think that there was a shot that, whether it's called Humana or it's called United or it's called Centene or it's called Clover or Devoted or whoever, do you think there's a shot that there is such a thing as an organization that is an insurer that focuses on the management and does it well of the subset of the over 65 and the Medicaid crowd who are chronically ill and manages that well? Do you think there's a shot that could be?
There's the elevator pitch. You just gave the elevator pitch for Oak Street Health.
I did.
Okay. How long are they going to take to cash flow? What about Iora? I mean, there are beautiful care models out there, which frankly, I'd love to have access to here in the wilds of Virginia. They're not going to get here. I'm not going to see them in my lifetime. So, this country is enormous. It's 335 million people spread out over umpty, million square miles. You've got to reach all those people. And honestly, I don't think they're going to be reached like this, like we are talking here now. I just don't think that's going to happen.
Ian, were you going to?
Well, no, I was just going to say, on this, I agree with the point Jeff's making is that there's a lot of variation, there's a lot of fragmentation, there's a lot of localization. I do think that United Healthcare is going to be around no matter what in any future. And I think Vince is onto something in terms of platform. It might not be a national brand delivering service. It might be something like Graphite, which is a national infrastructure play for those localized systems. That's, to me, a very plausible outcome of all this. And I think going back to the theme that Lygeia gave us to deal with, I think what I take from that conversation is that there are people in different places, different segments of consumers with different views of how they want to engage. And then Life Course intervenes with each of those segments.
Right.
Like, what was Mike Tyson's line? Everyone has a plan till you get punched in the face.
Totally get punched in the mouth.
And so I think it's very hard in America to get out of here, without dealing with the medical care system seriously. And Jeff and I have had experiences of mine more recent, and it focuses the mind about what you really want out of the health system. And as I said, try taking 4 feet of bloated colon out at home with an iPhone. It's not freaking happening.
It's the self-directed surgery.
Good.
The phone up. It works. It does work for a home COVID test. Something like quite successful.
Yeah.
Wasn't shoving the nut. I was shoving all the way up into the back of the brain. Yeah. No, I agree. I mean, look, it remains. It's going to remain incredibly complex for a while. I'm just wondering if you're seeing in other industries, it doesn't get to like a simple level, but you get to the point where there are, dominant national players in many other industries and franchise-based or whatever they are. You can see it, it doesn't, maybe it's not one or two or three, but it's said in the banking industry or the airline industry, we're coming down to like a manageable number. We all complain about the ones they've got, and there are obviously people who try to go around it, and there are always startups in any area. There are little banks you can go and use that are not connected to the big banks and all the rest of it. But it doesn't look like that in healthcare. And I think part of the issue was, as was raised at the start, was the trust, right? It looks like you should be able to do that with Medicare Advantage plans. So right now we're being told by some very smart people they're really sticking it to us. Jeff's been on the show talking about, attempts to upcode him, in the risk adjustment factor. And I don't know if we can get there. I mean, the employers are a big deal, but they're not, Ian, you said this, they're not that big a deal, right? I mean, they're a big chunk of the market, but they're not a big chunk. And it's really, because we're so focused in healthcare on such a small number of people who cost so much money, it's hard to sort of think of some of the national, it's not like a rational national level purchase that you make at one time. So I'm with you. I think it's complicated indeed. I don't know if it comes. I mean, I still think we're going to be arguing this in 10 years. Does it come from a sort of independent third-party consumer advocate? Does it come with the consumers themselves sort of taking charge and going on the barriers? Or do we get some kind of system where they look after the consumer / patient better than they've done so far? But most of, the thing which I told the Japanese drug company, the next big deal for the next 100 years, well, I told them one, which is eventually all the money spent on biotech and, drugs and Moderna figuring out mRNA was going to cure all disease, so we're going to be fine. But in the meantime, we were going to do a much better job of managing. If we're going to do a better job, we're going to try to manage chronic disease and acute care, all the time rather than point solutions as we tend to do now. And that does mean that the organizations doing it have to change. I go back to my Karl Marx days. It came like the poor woman this morning, who's the poor person becoming the controller of the currency, is that, Karl Marx taught you that the factors of production, when they change enough, when technology changed enough, the relations of production changed too. We went from, feudalism to capitalism or wherever we went to. And at some point, the organizations we've got now can't sustain the kind of healthcare we need to have in the future. But yeah, as you said, United Healthcare is going to be around for a long time, and maybe they can make the leap. I would say that it's worth looking at, what's happening in the world of the automobile, where you're seeing this, whether it's mass hysteria, but you're seeing now the second most valuable automobile company in the world is an electric car company that hasn't actually delivered a car yet.
Right, Rivian.
Rivian compared to Volkswagen and BMW. And Volkswagen's selling a lot of electric cars, so we'll see how it changes.
Ian said something important a minute ago, is that you can talk about all this in the abstract all you want until you get your cancer diagnosis. Okay, and that really was a Rubicon crossed. You end up having to trust someone, and I mean, and there are cancer events that happen in people's lives. People that haven't experienced them are in a different existential state than people who have. And they view this whole process and the health system very differently.
Right.
And it really is about a search for trust and trusted knowledge.
Yeah. Well said, Matthew. I got to skate to a meeting, but in terms of next week or next time around, let's hope that we're going to have a bit of a postmortem and build back better, and that there is actually something that gets over the line. So that's what I'll leave you with, and I'd love to see you guys all again before the holidays. And,
fantastic. We'll definitely have our big roundup show on the 23rd of December. So I'm looking forward to seeing you all there. Right now, we are out of time, so I will say thanks to everybody who has been on the gang today. I'm having a bit of weirdness again with my sharing of my screen. Hopefully that one works for everybody. You heard from Ian Morrison from the Mars Menlo Park. Ian's just to skip out. Jeff Goldsmith from the wilds of Virginia. Literally, you can see behind him. Vince Kuraitis from the completely wilds of Idaho. And Lygeia Ricciardi from the very civilized urban confines of Washington, D.C. That was THCB Gang for November the 18th, 2021.
Civilized.
I am your host, Matthew Holt, founder and publisher of the healthcare blog, Look forward, whether you've been watching this live or are going to listening to this on the podcast. Thank you for your time. We will see you same time, same place next week, and for another episode of THCB.